Hello, everyone, and welcome to our last in-person session of the Spring 2023 series of Tuesday Times Roundtable. Today's session, a wide view of health equity, social determinants of health. My name is Michelle Zaldivar, your Senior Program Coordinator here at the Office of Global Learning Initiatives. TTR is our flagship discussion series that brings together multiple perspectives on current global issues and trends. You can learn more about TTR, watch past recordings, or come back and reference this one at go.fiu.edu/TTR. We return next week, but fully online. Today, we do remind you to please use the mics when we're contributing to the discussion so that we can hear everyone's contributions on the recording. If you haven't already, definitely take a moment to sign in. This QR code is where we'll capture your attendance, whether you're here for Global Learning, Honors College, or credit points from your professor. We're glad you're joining us, but this is where we capture that information. And as always, TTR is tied to a New York Times article. TTR is brought to you through a formal partnership with the New York Times, Office of Global Learning Initiatives, and Green Library that gives every student at FIU free digital subscription to the New York Times. So you can access today's article at go.fiu.edu/0328. If you got to that article and you hit a paywall, you just haven't accessed and started your digital subscription just yet. So you can go to accessnyt.com, put Florida International University, log in with your @fiu.edu email address, and you will have free digital subscription until you graduate. My medallion students and my Enacting Global Learning micro-credential students, please make sure to take a screenshot of your confirmation page on that sign-in, right? Or save the PDF so that you can use that for your points log. If you have any questions about any of the global learning programs, including PC Prep, the Enacting Global Learning micro-credential, the Excellence in Global Learning medallion, or the Millennium Fellowship, please hang out after today's session. Anna Prado, our Assistant Director, who you met out in the foyer, and I will be glad to answer any of your questions. We want to highlight an event that we're doing next week as well. UNICEF USA is joining us here on campus Thursday, April 6th at 12:30 p.m. over in GC. I actually don't think it's in GC 140. I think it's in GC 305. I will confirm that later and let you know. But the best place to get that information is absolutely on our Instagram. Highly encourage you to follow us at GoGlobalFIU. UNICEF is doing a participatory training to learn about child rights, their importance, and how to implement them in your work regardless of your major or profession. So for today's session, leading our session, a wide view of health equity, social determinants of health, is Dr. Barbra Roller. Highly recognized for her student advising as well as innovative teaching, Dr. Roller was the founding assistant dean of student affairs and is now the assistant dean for academic affairs at the Herbert Wertheim College of Medicine. She continues to teach, including courses for pre-med students at the Graduate Certificate in Molecular Biomedical Sciences program and in the FIU Honors College. She is passionate about inspiring youth to pursue careers in STEM and healthcare fields, and to this end has been instrumental in creating 7 pipeline and graduate programs here at FIU. Roller received her PhD in biomedical sciences from the University of Pennsylvania, her AB in biological sciences from Barnard College in Columbia, and joined the faculty at FIU in 1994. Roller has a particular interest in innovative teaching, incorporation of active learning strategies into her classes, and the creation of new educational programs at both the undergraduate and graduate levels. Joining us today for the session is also Onelia Lage. We did this before. Onelia Lage, MD, is a professor and chief of education and faculty development in Humanities, Health, and Society, and is the director of pediatric and adolescent health for the Green Family Foundation Neighborhood Health Education Learning Program, which you'll hear more about today, aka NeighborhoodHELP. She completed her residency in pediatrics in Metropolitan Hospital Center and New York Medical College and her MD in Universidad Central del Este in the Dominican Republic. And her focus in research areas in innovation and medical education focused on interprofessional education, social determinants of health, and chronic disease prevention. Also with us today is David R. Brown, MD, the professor and chief of the Division of Family and Community. He leads the award-winning Green Family Foundation Neighborhood Health Education Learning Program, NeighborhoodHELP, that you'll learn more about today. and is a fellow for the American Academy on Family Physicians. He completed his residency in family medicine at Natividad Medical Center in the University of California at San Francisco, and his MD at Boston University School of Medicine. His current work includes projects related to the development of data systems for assessment and care management of social determinants of health, COVID-19 testing and vaccination in the community that is part of the NIH RADx-UP initiative, and obtaining user input in the designs of apps to help manage diabetes. And our last panelist today is Julia Bisschops, Assistant Professor for Humanities, Health, and Society. She is the lead physician for the Linda Fenner 3D Mobile Mammography Center. Did I say that right? Thank you. She received her MD from St. George's University School of Medicine in Grenada in the West Indies, and her family medicine residency at Memorial Hospital in South Bend, Indiana. Her active grant is an Augment History-Taking Skills and Chronic Disease Management in Community Setting Agency, American Medical Association. Please join me in welcoming all of our speakers today. I'm going to interrupt myself, and I'm going to rewind because we value absolutely everyone's input today. We will also have two students with us today that are going to share a little bit about their experiences, and we'll get a little more of an introduction to them when it's their turn to participate. Thank you so much, and join me in welcoming our panelists.
Well, welcome. So in order to introduce the topic, we have a short video for you and then a short PowerPoint so that you can understand a little bit more about the social determinants of health before we kick off our discussion.
In America, the best predictor of how long you live is where you live. Take these two examples, Key Biscayne and Opa-locka. Same county, but worlds apart. Key Biscayne is one of the wealthiest neighborhoods in Miami-Dade County. Most people who live here have high-paying jobs and a college degree. In fact, just 2% of residents do not have a high school diploma. Not only that, every single public school has an A grade. Life is so good here that the average person lives to be 87 years old. The same can't be said for the residents of Opa-locka, one of our NeighborhoodHELP areas. The average person here will die 14 years earlier than in Key Biscayne at just 73 years old. In Opa-locka, the average public school has a D rating. It's probably no surprise that 27% of Opa-locka residents don't finish high school, and only 11% have a bachelor's degree. The consequences of not getting a complete education are immense. In Key Biscayne, the median household income is $121,000 per year. In Opa-locka, $19,000 per year. What causes this great disparity between the rich and the poor? The answer is social determinants. Social determinants are the conditions under which we're born, grow, live, and age. From the school we attend as kids to the parks we play in and the jobs we get. These conditions are shaped by the systems that govern our access to money, power, and other resources. Plain and simple, richer people can afford to surround themselves with the best of the best, and as a result, they tend to be healthier. So that's great for those with money. But what about poor people? How can they impact their social determinants and get on par with the richest among us? Research says the single most powerful tool we have to affect change is education, and that is where you come in.
Hello, everybody. As Dr. Holder said in the video, the evidence is that the bulk of determinants of health outcomes relate to social, environmental, behavioral factors. Genetics and healthcare play a lesser role, right? Before the Human Genome Project, there was a lot of thought that we would unlock all of the genetic causes of disease, and in fact, we found that some diseases are genetic, but for the most part, most of the diseases that people face in the modern era are related to behavioral and social factors. So if we think about this, much of this is determined by history. A lot that, history determines the structures that form the structure of our social environment. There are laws, technology. The built environment is constructed in such a way that rich people have their neighborhoods constructed in one area. Poor people, sometimes close by, but poor people have their neighborhoods constructed in different ways. Oftentimes, money money can be turned into a lot of things, right? So if you have enough money, you can have nice housing, or you can buy education, things like that. So money is one of those social determinants that's very transferable. But your work and your education are things that help determine to a great degree how much money you'll have. Of course, having money helps get you prepared for education, which prepares you for work. Then you see that the housing and our neighborhoods are structured. The healthcare system, transportation are overlaid over this history, and that leads to patterns of behavior, activity, food, wellness, relationships, which are very much influenced by the social structures and our own history and upbringing. I like to look at this picture, and I just want to ask if you can identify social determinants of health in this picture. How many social determinants of health are represented in this picture?
One, the fact that she's using a Peloton.
So what
She has access to even buy that piece of equipment. It's around $2,500 starting. Her view, she's able to work out inside her home, so she can have space to have a home gym. Whereas other people might not have that option to have that space.
right? So obviously money, housing, neighborhood. What else? Yes.
I would say time. Most of like working families and like low income families, people have to work all the time to fulfill their basic needs. So like when there is time that they can actually fit in a workout in the daily life.
Mm-hmm. Others? Internet, so technology, right? Technology both in terms of access to the internet, because Peloton is connected, wired, but technology, somebody built that device, that's she probably, other technology as well, right? She has air conditioning, we presume. It's not 95 degrees in her house. What else do we see?
Green space outside.
Green space, so neighborhood. I see that she's got, yoga mats and other exercise equipment there. I'm going to presume that she's had education, that she's got some degree of health literacy, and as well that she's got something that I would call embodied cultural capital, meaning she was raised with access to and the expectations of doing this kind of exercise is something that we should all do for our health, right? People with less resources, less social supports around them may not perceive all that. So good job, thank you very much. If we think about the neighborhood and the world around us, this is what it looked like, not that long ago, 100 years ago. We were in the Everglades, wetlands, and so everything that we see around us is a built environment, right? There is no South Florida natural environment unless you get out into the Everglades or maybe out on the ocean, because every bit of land that you see has been engineered, and everything that you encounter, every tree that you come upon in your neighborhood has probably been planted not just evolved naturally. And that all started when the railroad came and they opened up, and then after building the railroads, they built the highways. And so our entire structure of how we live, everything is socially constructed. And so, we get from this to this, in 100 years, roughly. These are some pathways. Dr. Holder talked about education, but ways in which education leads to health. So educational attainment gives you knowledge, which helps in order to behave in a healthy way. You have to understand and have an understanding of health concepts. Educational attainment also helps you get work. So work brings you resources. Work determines how much risk you have in your day-to-day life in terms of are you lifting heavy objects, or are you having to be exposed to chemicals, or do you have the freedom to work from home, for example. It also helps you establish housing and other factors. And then educational attainment also gives you a sense of social standing and control. And so the respect that you get opens up a lot of doors. So as we can see, there are many interrelated pathways in which education leads to health. And we could do this for work, we could do this for neighborhood, we could do this for money, we could do this for each of these different social determinants of health. This is the poverty rate of developed nations. And what we see is that the United States has amongst the highest rates of poverty of any of the modern developed nations in the world. In addition, the poverty gap, the difference between the wealthiest and the poorest within the United States, is also amongst the highest of any nation in the developed world. When you look at the social spending, on the other hand, this looks at healthcare and social spending. So in the United States, in blue, our healthcare spending is roughly twice what other countries are spending on healthcare. But our social spending on helping people to have the education, the housing, those other things that help people, time off to have a child, daycare, those things, that support is correspondingly much less. So that means that the burden often falls on those on the lower end of the socioeconomic status. Those on the higher end have resources to build their health, whereas there are much fewer resources available, and that explains the existence of health disparities in the United States. So much is socially constructed, and there's so much poverty and lack of social services available. This is from the Assistant Secretary of Planning and Evaluation, talking about upstream and midstream investments. We talk about upstream being the structural determinants and midstream being the social determinants, and downstream being like health factors, right? So your healthcare is a downstream, your education is midstream, the policies and rules are upstream. And so housing first policies, investment in the built environment to create healthy environments, transportation, particularly making public transportation more easily accessible, providing people transportation, for example, to healthcare, economic supports, earned income tax credit, just giving people money, early education and food assistance. All of these things have been demonstrated to have an impact on health outcomes.
So the question is, how can we address the social determinants of health, and how do we teach this to our students? So Dr. Lage is going to tell you more about the NeighborhoodHELP program.
Thank you, Dr. Roller, and welcome, and I'm so glad to hear how many of you have heard about NeighborhoodHELP? That's very good. A few, good. So the Green Family Foundation Neighborhood Help Program is our HWCOM, our medical school's signature program in terms of how we teach not only medical students, but other health profession students about social determinants of health, about social accountability. How do you become that health professional that helps patients get to where Dr. Brown was saying in terms of actual health outcomes? And it's different for everyone, correct? So Neighborhood Help began in terms of with the concept of creating this curriculum where you're teaching doctors, right? So oftentimes, and other health professionals, oftentimes what happens is physicians get trained and then they go on to their residency programs, and that is where they first learn about other professions. But here we're starting from scratch. Social determinants of health, I'm not going to date myself, but when I went to medical school, that word did not exist. That being said, disparities have always existed, right? And social needs have always existed. So when you're working with underserved populations, being an immigrant myself, serving many underinsured and uninsured children in my lifetime, it becomes a critical factor. And it's awesome that we are able to teach this to all of our students, yourselves and our health profession students. So Neighborhood Help is a longitudinal service learning program. It starts in year 1 of medical school and finishes in year 4. It is interprofessional. It involves medical students, nursing students, social work students, law students that collaborate, PA students, physician assistant students, and it involves our outreach team, which is our public health arm, boots on the ground, the people that actually create our linkages with the communities and find our patients and our households. And there's our next step. It is a household-centered care model. Students actually go into the households, either in person or after COVID via telehealth, to visit families that are typically uninsured. A few of them, sometimes some members of the household are underinsured, and you'd be surprised. So many of us may or may not have health insurance or haven't, but you may not have behavioral health access of things you need. I took care of adolescents, so sometimes if you have an eating disorder, well, it's difficult to find the special health care providers. So many of our households are uninsured and some are underinsured. It provides, our program provides obviously the learning of social determinants of health that you heard from Dr. Brown in practical ways, and how you go into a household and see the need, and you're able to open a refrigerator, you're able to walk and say, oh my God, this poor little old lady is a hoarder, and she can, if she walks through this place with like all these things on the ground, she can trip and fall and have a hip fracture. And so a lot of the issues that you see, right, the heat, the mold, all of those components that in a clinical office, which is where I lived a lot of my life in clinical medicine at Jackson. So I did take care of, I never saw that really by working in a little clinic at Jackson. And I was taking care of uninsured, and I didn't know. I had to believe whatever they taught me or told me about their household. And that is really important. So getting that perspective is important. Students are able to work in a team setting and understand other professions. We have something called the Interprofessional Workshop, which is done in the first year of medical school, and it covers a bunch of other different disciplines, not just the ones that I mentioned. The ones that I mentioned are the ones more clearly directed with the household visit. But others that students learn about in general are dietetics, physical therapy, speech and language pathology, and then a lot of the other ones that I mentioned, right? So social work, not public health, but physician assistant, nursing, and all those other factors. Oh, yes, I'm sorry. Yes, thank you. Oh, I didn't realize I had that many slides. I was just talking. Thank you. Very good. So in terms of household-centered care, this is a little bit of what we established, and we address the underserved neighborhoods in Miami-Dade County. So one of my special criteria of coming to work here when I first came, and Dr. Brown will remember that, is I had to be in Hialeah, Dr. Brown. You remember that, right? Because I grew up in Hialeah, and there's nothing more beautiful than to be able to go back and serve your communities, and so you may go away to school, but come back, right, in terms of being able to serve and create those policies and those services that will help your community and improve population health. And this is the teams that we talked about. Education, you heard Dr. Holder. So that video that you saw, I was the one that was driving around Key Biscayne and like taking those crazy pictures, and Dr. Holder was in Opelika. But it was really eye-opening for myself, and this is something that we have our students do. Actually, they do something called the windshield survey, and they drive in teams in their car to Opelika, to Little Haiti, to different neighborhoods in Miami. We're in South Miami, we're in Hialeah, we're in Medley, North Miami Beach, et cetera. And to see the cultural influences of our community and how that impacts health, right? We saw the lady on the Peloton. Well, I didn't see no Peloton growing up. And so it's very important that we understand that when we prescribe things to patients. I remember recommending one of my little adolescent patients who was very overweight. So you talk about, healthy eating and exercise, et cetera. And one of the things I recommended was, for her to walk around the block or, just do things outdoors when she came home from school. And the mother says, oh, absolutely not. She needs to go home and lock her door because they sell drugs in the corner of our house. And I remember I was just in training, and it opened my eyes to say, wow, I really have to pay attention to what I prescribe. I have to ask these questions, and we can't just assume. So again, the collaborative partners, we talked a little bit about our interprofessional workshop and all those other partners. Even if you don't, it's a very key piece, right? So collaborative care is essential to any kind of work, but in the health professions, the outcome of your patient's health is critical. You can be in an OR, for example, and if the surgeon's not communicating well with the OR nurse, or maybe is rude, or doesn't understand what the OR nurses or the tech or the anesthesiologist or nurse anesthetist roles are, there could be gaps, and there could be errors, and there could be issues that result in health conditions and obviously mortality even for that patient. The better they understand each other's role, respect each other's role, and communicate effectively, the better outcome for patients. And so this is a beautiful little picture of us in a household, for example, where an outreach team member is a nursing student, a medical student. In this case, these are 2 medical students, but we'll have nursing students, PA students. Back then, we didn't have PA students. So it's growing, and it's a beautiful experience. And I will introduce you to Dr. Julia Bisschops, who takes care of our mobile mammography. I think she can talk a little bit of our other mobile health centers also,
Sure.
that I didn't.
Yeah. So welcome everybody. So you guys heard about the NeighborhoodHELP program, which is housed within our department called Humanities, Health and Society in our med school. So the other thing that we have is the Mobile Mammography Center. We call it the Linda Fenner 3D Mobile Mammography Center. We just call it the MammoVan basically for short. Has anyone seen it, know about it? Yes, I see some hands. So what it does is it provides free screening mammograms to patients that are uninsured and sometimes underinsured in all of Miami-Dade County. So we have covered more than like 98% of all zip codes in Miami-Dade. We have some places that we go to regularly, so we do this by collaborations with community partners. So we have faith-based institutions, community health centers, all kinds of different partners in the community, and the van goes there a couple times a week to these different centers. Some of them are like scheduled regularly, and to some of them maybe we go like 2 or 3 times a year. Also, we go to some health events whenever we're asked to do so. The van is run by a team, so we have a mammotech who does the actual mammogram. So the van that you see here actually has the mobile mammography a machine inside. So we have a tech that does the actual mammogram. We have an administrative person that registers the patient. We have a director of all of our clinical operations, and we also have a breast health navigator, meaning like when the results come in, she helps to explain those results together with me, who's the medical lead, and kind of keeps an overview of the results and any kind of further workup that is needed. So that's kind of what we do in a nutshell. We've done close to 6,000 mammograms. We first started in 2014 and are still going strong. Thanks to our student leadership, so we closely together work with our students, right, because we're a med school, so that's certainly one of our biggest missions. The students have been phenomenal, so within the last 2 years, the students actually volunteer in our memo van. So if you're going to be one of our medical students in the future, will have the opportunity to just volunteer and sign up, and then actually able to be with the patient while they get the mammogram, register them, talk to them, provide education, etc. So that's something that's new. Also, another story that I really like is that one of our students actually made a connection with one of our partners in the community. We had not had a community partner in the Muslim community, so we actually formed a partnership with the a great Islamic Society of Greater Miami. So because of that, we have been able to screen like close to 40 patients from that community, and we go back there regularly, and that's actually one of our medical students who completely formed that partnership from the ground up. So that's one of our stories that I really like. Dr. Lage told you about the Neighborhood Help program and how we do the visitations in the community. So in addition to this van, we do have 2 other vans, correct? 2 other vans that provide just primary care in the community, and this is part of the Neighborhood Help program. So those families, you saw a picture, and those families that are enrolled in the Neighborhood Help program, if they don't have insurance, they can also get primary care services completely for free. Dr. Brown actually sees patients on one of them. So there's 2 other vans that don't have a mammogram in them, but instead they have like two patient rooms, and they drive around Miami and go to the same site basically once a week. And some of our faculty go there weekly. Dr. Brown is one of them, so he'd be good at like giving you details if you have any more questions about that. They provide like primary care services. They can do blood draws, they can do EKGs, they can do pap smears. We have some like medications that we can give out. They can write, some other things full care primary care services basically that are completely free for patients that are uninsured. And the reason we bring this up is because this is about social determinants of health, right? And by doing so, we kind of try to improve things and give people that don't have access to care the access that they need and deserve to have. So I think the next one.
Thank you.
No, that's it.
Thank you so much. So now the question is, we have this great program for our students who are in the graduate health professions. What are we doing with undergraduates here at FIU? So I've invited 2 undergraduates that I currently have in my class in the Honors College to tell you a little bit about what we do in the Honors College course to teach social determinants of health.
Hello, is this on? Awesome. Hi guys, my name is Kevin, and as Dr. Roller said, I'm in her class in the Interdisciplinary Honors Challenges in Healthcare course. And one of our assignments last semester was to go over these social determinants of health. So basically what we did is we were given different addresses at random, and we were supposed to look up health disparities that we find in this zip code. And then we were also given a case and supposed to research some different things about this area. So we also used Miami-Dade Matters for this project, and this is something all of you guys can access. Has some really useful information about different zip codes in Miami-Dade. So this was our case, patient with diabetes in Miami-Dade, and we're each given address and zip code, as I said. And the doctor recommends eating 5 servings of vegetables and walking 30 minutes per day. So one of the first things we're looking for on Miami-Dade Matters, is there a health disparity in this neighborhood? and then we would list what that disparity was. And then now we're going over a bunch of things. One of them, as Dr. Lage mentioned, is there even a sidewalk in the area where the person could be doing that exercise and walking for 30 minutes? So obviously one of the big ones, income, transportation, school, what those schools are rated as. We've also got fresh fruit and veggies. So we're going to be looking for different grocery stores in the area, how close they are, within a 1.5 mile radius, how much those things cost, which we're going to go over in another slide, closest pharmacy, nearest medical facility, and so on. We're going to look for costs of a pound of carrots versus a fast food hamburger. So sometimes in these areas we'll find a lot of fast food restaurants just on one street. So how close are they to these fast food restaurants is another thing we'd be looking for. And then we'd be comparing costs of different grocery store items and things we'd find that are probably not so healthy and good for health outcomes. We also compare a pound of apples to a 2-liter bottle of soda, and the cost of Lancets and metformin at the closest pharmacy because it's a diabetic patient. Just for anyone who doesn't know, Lancets are things a diabetic would use to prick their finger and monitor their blood glucose levels, and metformin is a medication used to treat diabetes. So one of the things we did is we found all this information. We're going to make a map. We're going to see how far all of these different locations are so we can visualize it. And we're basically just creating like this whole project around this one address. The median income and education in the area, again, one of the social determinants of health. And access to transportation is already mentioned. So we're going to then propose a policy that would address the health disparity in this neighborhood. So as we already mentioned, using Miami-Dade Matters, we'd find a health disparity and then try to create a solution for this problem for the address. Courtney will be taking over.
Hello, everyone. My name is Courtney. It's nice to see you all here. So in Dr. Roller's class, when it came to what did we find as students regarding health disparities, we actually found that in the United States, where you live matters. Your zip code can lead to a higher or a lower health outcome and lower life expectancy. For example, when we examined in class the data from VCU Society and Health, we found that residents that live in Overtown, they have a life expectancy of 71 years old, versus residents who live in Brickell, they have a life expectancy of 86 years old. That's a problem. You might ask, why is there a 15-year gap in health expectancy between the two zip codes in Miami? Well, that's because of what we discussed earlier about the social determinants of health. Ultimately, if a patient has the lack of access to transportation, healthy food, or they have problems paying their electricity bill, it's harder for them to be able to get the things they need and treatments they need in order to live a healthy life. And it's very important that we discuss and go over social determinants of health. Yes. So the solutions that me and my classmates proposed in class were legislation. So one of the classmates recommended that, our patient has diabetes, so they recommended that we discuss with legislation to open up more green space and sidewalks. Because just like how one of the doctors, Dr. Lage, said, if you were to treat a patient for diabetes and you tell them you need to live an active lifestyle, you need to go out for walks or ride a bike. If we tell them this, but we don't take into account how is their environment? Is it safe? Do they have enough sidewalks? How can the treatment be effective? So in our future careers, me and my classmates will incorporate social determinants of health by taking into account all these factors. If we're a doctor and we're going to, let's say we diagnose our patients with type 2 diabetes. Okay, we give them the diagnosis. We tell them, okay, you need to take your insulin. But what did we forget to do? We forgot to see and research their background. Do they have enough money to afford the medication? Do they have a walkable area where they can go walk and be healthy? Or do they have Medicaid? Do they have insurance? We don't know that, but we need to take these into effect, and we have to basically just make sure that these patients are able to afford
the medication, but if they're not, what we can do as doctors is we can find places like Camilla's Health Concern, Shy Health Community Center, where these are free community centers where patients who have diabetes or uninsured or underinsured, they can go to these places and get metformin for free, which is really good. And Camilla's Health Concern offers transportation to the patients that have lack of transportation. They are given like buses. Well, people in Camilla's Health Concern will drive and then pick them up, take them to Camilla's Health, and give them metformin or other stuff that they need that they can't afford due to like having low income. And the education is also important too, because if you have low education, let's say certain jobs require you to have like high education or higher degree, but if you don't have that, how can you work those jobs? How can you get health insurance? And all of this is just like an endless cycle. And it's very important for future doctors of America to be able to know this and know how to appropriately address it. Thank you.
Okay, so for this part, we were going to have a panel discussion. I know that some of you had written things on Post-it notes, which I have here, and I guess the prompt was, how do you know you're healthy, or something to that effect, and what is health? One person wrote, feeling good with myself. I'm not sure exactly what that refers to. Maybe that person would like to elaborate. Economic situation, safety, food, genetics, those are all the things that we did mention in the intro. Diet, genetics, the environment, true. Lifestyle, diet, right? Mental health, a lot of people are writing diet. And we were delighted to see that the food for this session was actually, with the exception of those delicious cookies, which I haven't had yet, but very healthy. Good habits, right? And we saw from Dr. Brown's slide how habits are extremely important in your overall health. Right? And some people wrote about mental health, and this, of course, is now becoming more and more important, I think, since the pandemic, that people are realizing the need for interventions in mental health, not just physical health. So I'm going to open it up to questions from you guys, and let's see what happens. Anybody have a question? Do you want to give her, bring her the microphone. Thanks.
Thank you so much. I want to ask you about your class for the Honors College. Are you teaching next fall?
Very practical question.
Yeah.
You're teaching next fall?
Are you teaching?
Am I teaching next fall? Yes. So for students who are in the Honors College, it's an IDH 3034 and IDH 3035. You don't have to take one before the other, except that people usually sign up for IDH 3034, which is Challenges in Healthcare 1, and then stay unless they have a conflict. Pretty much the whole class, except for one person who had a conflict, stayed in the class. Yes, you have to be an Honors College student, and registration is open for that class. Well, I don't know if it's closed yet, but registration has occurred.
Thank you so much.
You're welcome.
Okay. How do you feel like, because I feel like this is so fascinating, I have heard, but I think it's so incredible. How do you feel can we take the results from these projects and implement them in developing countries who do lack that central medical care for its people? So how can we take this abroad?
Do you guys want to answer that? Because I don't go abroad. We do have many of our faculty who do medical mission type trips. Like Dr. Holder goes, she's been to Cuba and she goes every year to Jamaica. And she does implement a lot of these things, or she tries to, working with neighborhood associations and working with the governments. Yes, it's possible.
Yeah, so I'll tell you a little bit. I went to medical school, as you heard, in the Dominican Republic, so that was my having grown up here in Hialeah, that was my first experience with a third world country. And you're absolutely right. The disparities are really beyond understanding. I saw diseases there, for example, with children, kwashiorkor, marasmus are like really severe malnutrition that I've never really seen here. That being said, I'm a very big advocate in the United States. I worked in Spanish Harlem and Jackson Hospital and now FIU NeighborhoodHELP. And so we must never forget that there is a lot of poverty in the United States, and we are not a third world country in terms of the extent. But for who we are, the expectations for us should be a lot higher. And I've always thought of creating a nonprofit one day that says Backyard Missionaries, because I like to think that my backyard is my responsibility. I can't always travel, I can't always go places, but honestly, I totally support and love those medical mission trips. It really opens your eyes to see the world, but then come back home and build those things here and create, hopefully, like little messengers that can go on to do good in the world, because basically that's what it is. When you go into helping professions, everything from education to health, et cetera, you are about helping people. You are about doing good. And so you do it where, bloom where you're planted, right? So you start right here, and then if you have the opportunity to go out and replicate, I mean, I'd love to see a neighborhood help in another country, wouldn't you, Dr. Brown? Yeah, and Dr. Bisschops, yeah. But that's pretty much it.
I think, so I'll get to your question also. I grew up in Germany, so they have socialized medicine. So when you saw in one of the slides that Dr. Brown discussed, you'll actually see that most first world countries, if you look at the European countries, they spend much more on their social aspects of things, less on, on healthcare, and overall their outcomes are better. That being said, I think we have phenomenal healthcare in the U.S. if people have access to it and if they can afford it. So we just have this big disparity. What can you do if you wanted to take that abroad? So during my residency, I went to Ecuador for a month. So I worked in clinics that were actually similar to almost like NeighborhoodHELP. We would have clinics that were stationed in more rural areas, and then we would go visit people in their households and provide vaccines, etc. So certainly those are things that you can do and that we can, support along the way. That's one thing. Also, we actually have our own faculty that have developed that work for non-for-profits and even have their own non-for-profits that go, one of them is Guatemala, for example, where they're actually helping to provide OBGYN care in the communities. So I think one thing to keep in mind is that the best mission work, in addition to really agreeing with Dr. Lage was saying that, there's a lot of work that, and that needs to be done here. But if you want to do that in terms of abroad, I think the importance is it's continuity of care, right? So the best way is that people go there and train and empower the people that live there in order to keep that going, instead of just going, doing a surgery, and then leaving. And what if there's a complication to the surgery? Or what if you give them medicine that you have for a month, and then you leave, and they don't have that medicine anymore, right? You didn't really help them. So I think, continuity of care is really important, like similar to how we have the mobile health center, that people can go there every week. That's their doctor. That's, so I think that's like some of the things. I hope that answer your question.
So besides keeping ourselves healthy, what can we do as individuals to help our communities stay healthy?
So social determinants of health are the conditions that enable people to be healthy. So do we have walkable communities? Is there are the schools strong? Are there jobs? These are the basic conditions under which people can thrive, right? If they have a safe home, they have a safe neighborhood, and this is all a matter of public policy, right? This is a matter of what the rules are that govern how we structure our society. And so I think that getting involved, right? Making your perspective heard, trying to understand what is, what policies are they thinking about? Are we building more roads? Are we building more gas stations? Are we trying to build walkable communities? Are we trying to make sure that housing is affordable? Those are really the core that allow people to have a place to grow healthy, I think. And we're all part of that community.
And I think what you can do is like educate and empower also. We've really shown that education is really important. And one part I really like about the Neighborhood Health Program specifically is that when it was set up that we have outreach workers who are people from the communities where we go that are the first people that have contact with our patients that sign up for the Neighborhood Health Program. So and that was done on purpose because that they are the ones that know the community best. They're the ones the patients trust in, and you're also empowering the community, provide them with opportunities for education. So I think like education and empowering is really important.
That's key, and you're all messengers, right? So many of you come probably from immigrant families, from underserved households, if we were to classify it as I did, for example, and you being here right now, your education, you are, remember I told you that messenger, right? That envoy that goes out into your own immediate family, and how you can empower, your grandmother to take her insulin and help with that process in terms of health literacy. So the more you educate yourself, the more you help your immediate family and then also your community and greater at large.
Okay. Good afternoon. I wanted to thank you for this incredible presentation. I was doing shadowing with a pediatrician, and I wanted to ask you, because you've mentioned many times about how important education is for improving outcomes, especially with patients that you see in the long term, like pediatricians and family medicine doctors. So I wanted to ask you, how do you promote changes, like lifestyle changes to your patients, where maybe sometimes their ethnicities or sometimes their cultures teach them something different. So how can you educate them to have an impact, like a long-term impact that they can continue throughout their life once they already have their own lifestyles and their own cultures and yeah. So how would you try to promote long-term changes to their lifestyles?
You're asking a very difficult question, but as the pediatrician, I'm going to try and take a stab at it. I think one of the key pieces is understanding the cultures, respecting the culture. So we talk about cultural diversity, cultural humility, cultural competence right? So you have to be, and you don't have to know, like I can tell you a lot maybe about my culture because I lived it, I know it. That's why when we talk about our outreach specialists, if you grew up in Little Haiti, you're going to know more than myself, but myself can listen to you, can learn with you in terms of understanding why, because when you're at that pediatrician's office, you're trying to tell a mother, and brings back funny stories, I don't know, in our Latin stories, the grandmothers knew everything, right? So if grandma says something and culturally you're going against grandma as a doctor, it's not going to work very well. So what I'm saying is, if you understand that, right, in terms of the cultural health beliefs, I don't know, folk remedies with our Native American, all of our cultures have different processes in terms of, and respecting them, right? So as long as it doesn't harm, it's okay, in my opinion, right? If it's a tea, now if it's, for example, I worked in child abuse, and like coin rubbing is in our Asian communities, oftentimes it would be seen possibly as child abuse because they take a coin and rub in terms of I don't remember, in terms of lung and different aspects. So you'd want to educate the parent as to not to do that, and also that you're in a different country and it could be seen as child abuse, which is unfortunate, but it's a cultural thing, and at the same time you have to respect it and embrace it, right? So, but the long-term piece, it's really difficult, right, to do behavior change, and they do family medicine, and again, as an adult patient, it's hard, right? All of us, think of you, like, I know you want to exercise more, and you want to sleep more, you want to eat better, it's difficult. So not only does your culture, your finances, your time, your stress are involved. So to impose that on families is also difficult. So I take you to a place of humility. So, and obviously bringing your knowledge, taking baby steps, one thing at a time. Don't try to change their life all at once. Like, okay, tell me, in motivational interview, Dr. Brown is excellent with that, is like, what is that one thing that you feel that you can work with? You want the patient to feel empowered and successful, and then once they do that one thing, maybe you can go to that second thing, right? But it's a difficult process. Sorry.
I had a question. So based on the expertise that you guys have in medicine, the programs that you guys have been a part of, and the neighborhoods that you guys have gone through and saw, like the economic disparities between the people that live there, do you guys, and I know you can't tell the future, but do you genuinely believe that in our lifetime all Americans will be able to afford healthcare just by what you guys have seen in the lifetime of college students?
No.
But you got your work cut out for you, because I'm not quitting, right? So it's, again, it goes on, what is that little piece that I can do? And sometimes it could be voting, it could be teaching your family, baby steps, right? You shouldn't ever lose hope, but I understand, Dr. Brown.
And it could be politics. I mean, you have to vote for the right people as well, who are going to implement the policies that you would like to see.
We have 2 more minutes, so if we can keep it brief, our last 2 questions. Oh, yeah.
There's a gentleman that's been, he's been having his hand up forever, poor thing.
Or maybe I should do this now, if that's okay with the panelists. So it's 1:29, and I know that some of you, because of the nature of TTR, schedule us between your classes, and we absolutely appreciate that you're here. I want to do just a quick shout out, a reminder that, can we go to the next slide just for 2 seconds? That next week we go online, so if you show up here, this room will be empty. So if you want to go to go.fiu.edu/TTR online, you can register for our last 2 Zoom sessions. So if you do need to go because you're on your way to your class, I ask that you please very quietly and respectfully grab your things, and you are more than welcome to make your way outside. But if it's okay with our panelists, if we can go a little over time, we can address a few more of your questions, and we're not getting kicked out of the room, so we'll be here. Thank you so much for joining us.
My goal, my future career is to work in the federal government in whatever agency that is, hopefully Congress. My question is, based off your experience and your knowledge, what is some recommendation you guys can provide to creating any type of federal policy, or what federal policy would you like to see in place to help disparities and to help Americans just live a better and healthy life?
Who wants to take that? Well, of course, 2010, we had the Affordable Care Act, which did help a lot. In the past few years, several of our politicians have been wanting to get rid of the Affordable Care Act, which actually provided the ability for millions of people to get health care that they did not have before. I think we're going to have to watch what's going on with the different provisions of the Affordable Care Act. And one thing in the state of Florida that we did not do at the time of the Affordable Care Act was the politicians did not expand Medicaid. And if that's something that you would be interested in doing, we need to have more people in the state of Florida eligible for Medicaid. Medicaid is a federal and state policy, unlike Medicare, that's only federal. But the states have to then decide on the expansion of Medicaid to include more people. So I think that's another sort of hot topic in politics.
Yeah, I kind of want to hit your question, but I'm going to go back to her question first and then follow up. And I think changing behavior, some people are quite good at changing behavior, at least for dogs, right? Training a dog, you're able to change dogs' behavior if you have the right skills. And changing the behavior of your children at a certain age is probably more manageable than it is at a later period. If they're not your kids or your dog, then changing some other individual's behavior, that is a big challenge, right? I really don't think I can change other people's behavior. It's other people that have to decide that they want to change their behavior. So what I can do is I can listen to them and hear what's important to them and share information with them and have a conversation and a collaborative discussion with them about what's important to you, what are your goals, what would you like to improve, do you recognize that there are consequences of this versus that, and to develop a relationship of trust where they will have some trust and then maybe they can decide to change their behavior. So I wanted to follow up on that. And then on your question, I think things that reduce child poverty, things that create healthier environments in schools, in our neighborhoods, things that make housing more accessible and affordable. Obviously, as healthcare providers who deal with the downstream health impacts, it's very obvious to us how difficult it is for people who have a disease to get treatment if they don't have insurance. So things like Medicaid expansion, things like healthcare coverage for everyone, but also things like paid sick leave, a reasonable amount of maternal leave, paid maternal leave and paternal leave, things that help move people out of poverty, because when people are in poverty because the education system's broken, that they don't have the resources, that just creates a perpetual cycle, right, of poverty that gets transmitted from generation to generation, and is very, very difficult to overcome.
So I know we have 3 on deck. 1, 2, 3. That's it. Yes? Yes. Go ahead.
Thank you guys for being here. I just want to piggyback off the 2 things that you said. As an aspiring surgeon, I feel like it's very important from a family care perspective to know specifically what you would want implemented from a surgeon's aspect. I like how you stated that in the OR, it's very important to know everyone's role, anesthesiology, tech, OR nurse, and even the CRNA, and as well as the medical mission trip that you were talking about, going and performing a surgery, but after a month, what is the continuity, I love the word that you used, of care that would be implemented if the surgeons are not thinking from that type of aspect? So from a family care perspective, what would you wish to see or know that surgeons are telling their patients post-op and pre-op that will stay with them when they are seen in a primary care setting?
I'll give a few things, right? Number one is being sensitive to the social situation of your patient. If you're going to be a surgeon and you're going to tell your patient about how they're supposed to do their wound care or how they're supposed to prevent that, but you're making recommendations that don't work for a single mother living at home in a tenement housing with 8 children, what is realistic for this person, and what resources can you find to help someone live out that. And let's say someone comes to the hospital, and in this country, right, if you have an emergency, you have to be stabilized in the hospital. And so someone comes in and they have a incarcerated hernia, and you're going to do a repair of an incarcerated hernia, and they don't have insurance. Are you going to see them in follow-up? Are you going to take care of the patient in follow-up that doesn't have money to pay you? And so it's these things. If you're a healthcare professional, how do you adapt and adjust your own care to the realities that people are facing in order to make sure that as few people are dropping through the cracks? And then what can you do as a surgeon? Are you a trauma surgeon? And are you going to then get involved in healthy, traffic calming and healthy infrastructure in order to prevent injuries? Those are the kind of things that I think a surgeon can bring a special perspective to.
It's actually kind of a hot topic these days. If you look at the literature in terms of social determinants of health and surgery, there's a lot out there. Personally, we've had 2 colleagues that have been working on some of those things. And so think about it this way: outside of wanting to do the right thing, right, surgeons and other procedure-oriented physicians are also judged by how their patients do after surgery. So if you're an orthopedic surgeon and you are doing a knee replacement and you had no idea that the patient lived on the 4th floor, with no elevator, and they fell down the stairs and, they had to come back to the ER, that's horrible for the patient, but also makes you look not very good, right? So it's really, it's essential, whether you want to or not, to really take those things into account, because, you're not going to be able, to meet all those criteria that you should as a provider. So it's really important to you can do those things as part of the history and physical when you're seeing the patient in the office, or you can incorporate it into your template, to make sure you don't forget about it. You can have probably social work assist you with that. But yeah, it's definitely a really hot topic. So if you just look into the literature, there's been a lot of things written about it recently.
And a very quick point, give back. So there have been programs of surgeons, for example, a little bit of what Dr. Brown said, that you offer your time and your volunteering even within your community in terms of being able to, do free services. It's sort of like the attorneys with pro bono, and you can do that right here, or you can do it in another country. But to give back in those services, you're probably one of the higher paying of the physician. The giving back is really important. It also gives you that respect and value and compassion that comes with any kind of healthcare provider. Awesome.
Hello. Hey. Thank you for coming here and speaking to us about this. I'm pretty sure most of us are emerging medical students and future physicians. And so, practically speaking, we cannot tackle all of these social determinants of health at once, correct? And so, how do we prioritize these social determinants of health? And as emerging medical students and physicians again, how do we tackle these one by one in a matter of priority for the future generation of patients? And to that point also, which social determinant of health do you think is easier to tackle?
So, you can frame this in a number of different ways, right? And I think it depends on your perspective. I know that Dr. Holder, who did that video, she always talks about education being the number one social determinant of health. Obviously, money is a big determinant of health. In my view, the most important determinant of health is the one that's most important to the patient that's in front of me. And, if the patient in front of me doesn't have money for their medicine, then maybe the medicine is the most important to them. If they don't have transportation to get them to the doctor's office, then maybe transportation or telehealth is the most important to him. The challenge with social determinants of health is that they're so all-encompassing, they're so complex, and they're really, really challenging to deal with. And so I think where you as an individual and how you might possibly get involved in some kind of advocacy, right, public policy advocacy, I think that's strongest when it's something that's close to your heart and close to your expertise. So I mentioned the trauma surgeon who wants to work and take their perspective as a trauma surgeon into safety in the community and making that piece. That's a natural connection. Dr. Lage is a pediatrician. She's always going to be focusing on the children. Right, and that's, you're pretty safe if you focus on kids, because most people, most, even myself, I don't have kids, but my sister's kids are important to me, and other people's kids are important to me. There's so much future, so that's always thinking about what, that's a common denominator. Many of these other issues are very complex and can become challenging and political. And so I think if, as a physician, it's take them one at a time and being sensitive to what is important to the patient that's in front of you or what's important in the community that you're serving.
What I was going to say for undergraduates, get involved in community service. There's a lot of opportunity right here. You don't have to go out of the country to find things like, homeless shelters or food banks or, farm share or nonprofit organizations, United Way. We have a lot of things that our students are doing out in the community, such as STEM Saturdays, where they're going out to, to teach middle and elementary school students basics of the STEM fields, just not because they're necessarily going to be going into the STEM fields, but so that they educate not only the kids, but also the parents. And because I really feel education, yes, of course, the medication, but I think it all goes back to education. Really, if you think about all these other social determinants of health, just like the slide that Dr. Brown showed, like everything stems from, I think, education. And I think the place where you have to start with the children. That's where you have to start.
Always. They're the most important. I agree with both Dr. Brown and Dr. Roller. But I would tend to think that's right. So there's the immediate ones, the ones right in front of you, social determinants. But if you were looking at long-term and long-term impact, and I'm, again, looking at each and every one of you, and I'm looking at myself, right? Came in from another country, little immigrant family, and it is education that was able to take me to that being insured, to that being able to have an income, to me being able to mentor my children to have better outcomes. And again, so that education is that bridge, right, where the poverty and the rich that Dr. Brown was talking at the beginning, right, it can totally be that bridge. So going with the children, and it's different kinds of education. We look at school, right, but we also look at health education. And I don't know, if you're a gym buff and you're into exercise, and you can share it with little teenagers in different types of education. Financial, if you're a financial guru, teach people about money and saving money and how to make progress with that. But I do believe that if I had one to pick, I'm going to be biased. I'm a pediatrician. Education is key. Quality education, investing in our schools, investing in our children. That'll take a long time, but it can change the impact of the world.
I'm going to just say one more thing, right? And this is, to those to whom much is given, right, much is expected, right? And those of us who are in medicine are among the higher paid people in our community. We're among the higher educated people in their community. And so, if you have a desire to be giving back in some way because you have this privilege and you want to serve, what makes sense to you for service, right? For me, it's been, if I'm going to provide healthcare, I'm going to provide healthcare to people that don't have access to it in other ways. But other people, there's different ways that they are able to give back and give meaning to their work. And I think that it's very important in this day and age that you're able to take meaning from the work that you're doing. And if you can take meaning and also be doing something that's helping others, that's really wonderful.
And last question.
I won't leave here until that young man asks his question.
Okay. So what I'm actually going to say is actually quite similar to what you guys were just saying right about now. So throughout this entire panel, in my head, you were telling me, or telling us, all these issues. And I think a lot of these issues, what it comes down to is it's a symptom of the American philosophy, where it's how can I yield the greatest results in the shortest amount of time. So kind of like the first issue that you tackled was like the general health of those who are like impoverished. And so it made me think about countries in Europe where regardless of one's income, for example, their health is just way better because the cities, the way that they're built, it's designed to where they have to walk to certain places. So in those kinds of cities, that's a culture that was cultivated through generations and generations and generations of building. And our country, like for example, Miami, it was built upon how can we profit the most right here, right now, and build a system that's gonna generate the most profit. That there's young men and women who are like under their 30s who, because they're sitting down all day, because they have to drive an hour-long drive to their job and then sit in an office chair for the next 8 hours, their health is terrible. And they're still in their youth, they should still be perfectly healthy. And then it comes to the education. So another example of this philosophy kind of spreading into many different realms is, do you remember the show from like the 2000s called The Biggest Loser, where they'd bring in overweight individuals? Mm-hmm. So that American philosophy is of how can I yield the best results in the shortest amount of time. They put these individuals through horrible diets that are not long-term at all sustainable. They're not sustainable at all. They're like these people, they'll lose weight and they'll physically look fine at the end of the show, but all that ever did for them was just cultivate even worse eating habits because they just dieted them. They're not actually healthy, they're skinny, and like I said, we all care about the best results, so we want to seem like it's the best. Do you understand? Okay. So my question is, how do we combat, in my opinion, what are such multifaceted level problems that are so deep? What's the solution to them? So in my opinion, what I think the solution is to a lot of these issues is kind of what you were saying. It all starts with the home and the education, because from there, that's when you actually cultivate a culture of people who kind of understand how to take care of themselves and understand how to take care of a growing society.
That is the question.
I think you answered your own question, and that was very good. But absolutely, in terms of, again, bloom where you're planted. You can only, can we really control, like Dr. Brown says, can other people, we can only control ourselves, right? We know how but by improving ourselves, by doing the right things, we model, right, for others. We support others in improving that. And it's a very slow process, but being committed to it is important. And what you say, I think The Biggest Loser died, right? That program died. No. So eventually things that really are not done with a long-term, positive intent and again, what's truly good, what's truly best will, die out, right? Most of the time. And so it's important for us to focus on the good and what we can do to control and not get overwhelmed, because you can easily get overwhelmed with everything that needs to be done. Focus, take one thing, start with yourself, And then, little by little, it'll trickle. It's a trickle-down effect. Like the dominoes, I'm Cuban-American, so you throw those dominoes and they keep going.
I think that also the thing you have to remember, right, when we wake up, we have two choices, right? I can either get bogged down and be like, okay, the news are horrible, this is very sad, but, I cannot change any of it, right? But I think, like, as healthcare providers, we can't change the world, but we can at least make a difference for the person in front of us, right? And I think, when you feel like you're getting bogged down, I think that's an important thing to remember. So while we want to focus on, we wish we can make all those changes and we should be advocates and we should focus on education, I think we also have to remember, like, what is the change that we can make? And I think every one of us can make that change, whether you're a healthcare provider or any other person, right? Because you can empower your friends, your family, your colleagues. So I think that's something to, keep in mind when you feel like you're getting bogged down by, yes, the philosophy is probably not great. And yes, there are other countries that do a better job, especially in the primary care and, the health outcomes that we have. But there's still a lot of good things that we can do. So I think that's something to remember.
So with that,
and especially resounding applause for our esteemed panelists. Thank you so much for being with us here today.
And for Courtney and Kevin, thank you.
Yes, and to our students that contributed to the conversation. Thank you. Thank you so much for being here. We hope to see you again next week online. Enjoy the rest of your day.